Hello, this is Dr. Jaafer Golzar. I'm an interventional cardiologist in Chicago. I'm here with Dr. Sam Abbas. Sam, that was a great session today. Thank you so much for sharing that. So you put together a great meeting or a great session today, and you gave a really nice talk on, it was a debate with Dr. Chamberlain on which drug-coated balloon is better, the Lutonix or the impact drug-coated balloon. Could you tell us a little bit about your perspective?
You know, DCB, a drug-coated balloon, is mainly the number one technology right now in the peripheral world, and we have the two balloons available in the country, the Lutonix balloon and the impact balloon. And the question that everybody, which balloon is better, is this a data-driven or is a personal choice? I was able to review all the data, and it's difficult to come with a conclusion, especially it's not the head-to-head study, but from the data that I collected, the impact data is a really solid data. The results are great. The patency rate is in their data is higher, and I believe that the two drugs or two balloons are comparable. But in the Lutonix balloon, you have to follow a certain protocol, and you have to spend sometimes in preparing the vessels and work on that lesion to achieve the same outcome or the same results that the impact balloon did without even any of this. And now it's difficult for us to say which water balloon, but I will say we're very excited about the trial that you had. You're going to be the national PI, which is the HEROES trial that is head-to-head between both balloons, and I think that will give us probably an answer that a lot of people waiting to hear.
Yeah, we're looking forward to that clinical trial. You put together a great session, as I mentioned before. Could you tell us a little bit about today's session?
Yes, so in atherectomies, the faculty that we chose first are well-known, world-known faculties. We have it's a multidisciplinary, it's a mix of interventional radiologist, vascular surgeon, podiatrist, interventional cardiologist. And the reason we choose a faculty like this, because this is where we can have a multidisciplinary faculties with different opinion. Some of them, they believe in a surgical intervention, the other believe in an endovascular intervention. And because of this will give it more legit of a treatment and is a non-biased approach to the peripheral vascular disease.
Yeah, it was a great session.
So far, it's working very, very well, and it's very interesting to hear different perspective. And each faculty, they are familiar with multiple devices, but they kind of focus on a certain device versus the other. So it's really interesting to see what they believe in and the data that they back themselves up with. It was great seeing all these, well-known guys.
Yeah, absolutely. The live cases by Dr. Ramaya was wonderful. Sam, you've been with us for the past 6 years, and we really appreciate that. Just give us a couple of comments about CVC and why you think this is a great meeting.
First of all, thank you. Truly, it's a great opportunity that you allow me to be in this meeting. We started, as you say, 6 years ago, and I just told you before this is it's getting better and better. And that's when I remember 6 years ago when you said, I want the CVC to be of this young interventionalists that they're talented and busy to put together a meeting where present what we do in a real world. And I feel like Dr. Lopez just presented data from his own hospital, which is impressive. I mean, he worked on it. So I feel like it's a great size, talented people. They really appreciate the invitation and they put the best effort. That the speech that they did, the talks, is fantastic, and it's a very friendly environment, and it's in Chicagoland area, which and by the way, the hotel is fantastic too. Great choice.
Thanks so much. Well, thank you so much for putting together the session, and thanks for being with us. Thank you very much.
Great. Thank you.